It is now 6:45 on this Thursday. Medicine is changing so quickly now. Now you can even talk to a doctor via your computer. Skip the whole waiting room. We're joined by Dr. James, a doctor himself. We can find him at diamondphysicians.com. Dr. James, great to have you here on WILS.
Oh, thanks for having me on the show.
Now you have your own kind of practice, right? It's a boutique practice. Is that what they call it?
Yeah, membership medicine. We charge a capitated rate, a monthly membership fee for unlimited visits and no copay, and we actually include telemedicine within our membership packages.
How's business going?
Unbelievable. We have 3 locations now in the Dallas Metroplex. We're looking to scale across the country, and I'm building our own telemedicine platform called DoctorLink, and we're also trying to combine with employer groups to bring 30% cost savings on their healthcare spend to businesses across the country.
Has the Affordable Care Act affected your business in any particular way?
It's actually helped our business because insurance premiums have gone through the roof, and consumers are getting tired and fed up of increased out-of-pocket costs, higher premiums. So Diamond Physicians and the whole membership medicine movement is a solution to the largest healthcare crisis we've ever seen. So the Affordable Care Act is anything but affordable, and we feel like we're putting out a product that is truly affordable.
And when we have hospitals charging thousands for colonoscopies, how much would it cost, for example, if you were to go through a company like yours?
Colonoscopy cash pay is around $1,400, and the hospital can be anywhere from $3,000 to $10,000.
And how, in your view, how is that cost justified for hospitals?
Well, the problem is they're banking on an insurance payment, and the way the private insurers work is they look at Medicare, whatever they typically reimburse, the hospital will try and bill 3 times that amount, and whatever the private insurance pay them is what they get, and that's why the costs have gone through the roof, and we have so much price inflation because we don't know the true cost of care. So the hospitals don't even know how much it costs them to actually perform a colonoscopy or perform a certain surgery. So they just kind of make sure that they charge a lot. Some people aren't going to pay. Some people aren't going to pay the full freight, and then they lie somewhere in the middle after everything's said and done.
That's such a huge profit margin. Any idea what they do with all that extra money?
Well, hospitals are pretty profitable, and that's why they're popping up all over the country as well as these freestanding ERs. So they're paying their shareholders, they're paying their C-levels. They're making a lot of money.
Talking to Dr. James with diamondphysicians.com, and everything you do certainly is much more affordable, but you talk about the telemedicine, which how often are you doing telemedicine nowadays?
Oh, every day. At least once an hour, one of my clients texts, calls, or emails me, and that's the most efficient way to interact with patients. Now, every once in a while, of course, someone has to come in, and we need to put our hands on them and make a diagnosis the old-fashioned way. But 9 times out of 10, my clients can take a picture of the ailment, shoot me a text, tell me what's going on, and we can figure it out because 80 to 90% of medicine is algorithms. So we can figure these things out in the primary care setting via technology.
And how much does that cost, by the way?
Telemedicine is included with us. So we charge for just our telemedicine services anywhere from $55 to $75 per member per month. And that is unlimited visits, your direct medicine doctor. So you only get one provider. You are assigned a concierge doctor to take care of you and all your needs. So it's not like the other telemedicine programs out there where it's a queue. And you call that number and you get a different provider every time.
Somebody shows up, right? You get the same doctor in this case.
Exactly.
Which is good. Now, what if somebody calls and says, look, I'm in pain. Can you prescribe me some painkillers? What do you do in that case?
Yeah, we have to establish a relationship first. We're not just going to prescribe Schedule II narcotics. And in fact, you can't do that via telemedicine. Those have to be on a triplicate now. So, the DEA has really cracked down on, they call them pill mills. So it's actually impossible now to get pain medications via telemedicine.
So
you have to go see a doctor.
Most of the time then, when you're doing telemedicine, is it because they need some kind of medicine, you prescribe it to them, or is it resolved in a different way?
Yeah, sometimes they need a particular medication, like if someone has their annual sinus infection or a refill on a medication, they can just give us a call or shoot me a text, and I can take care of it. And those are the main ways that telemedicine is utilized. But if you have a chronic condition or need to follow up on something that has been maintained over the course of years, then, yeah, you need to come in and see your doctor, and we take care of you in person. But, again, 9 times out of 10, we can take care of the situation utilizing technology and with telemedicine.
Yeah. As a doctor, do you prefer to do it that way rather than having them come into the office and wait and all that good stuff?
Oh, either or. It's really our client's choice. I love to see our clients in person, but if it's more efficient for them and they're very busy people, and then I'm happy to take care of them in a telemedicine way as well. Yeah. The problem with traditional insurance is doctors can't get reimbursed for telemedicine, and that's why it's not as heavily utilized as it is in private medicine, where it's membership based.
Oh, interesting. Well, they don't get reimbursed at all for sitting down and talking to somebody on a webcam or something?
On a phone? No. They're just now starting to produce ICD-10 codes that can be reimbursed at a very small amount, but it's not nearly as much as they would get if the person came in for a visit. So it's really not a viable solution for the insurance model. It's the perfect solution for the private pay model.
If you didn't have this business of your own right now, would you still be a doctor, you think?
To be honest with you, I probably would be doing something else. I could not see 40 patients a day for 8 minutes, chart for 3 hours after work, and then go home to see my family. That does not sound appetizing to me, which is why I created Diamond Physicians and really honed this model so that I could have a great quality of life, spend an hour with each and every one of my patients instead of national average of 8 minutes. So the answer is no. If I didn't have Diamond Physicians, then maybe I'd be a radio host or something.
I can hear you doing that, though, too. Dr. James, find him at diamondphysicians.com. Thank you very much, Dr. James.
Oh, thanks for having me on the show.